Hello, good evening everyone. So welcome to my channel, Icons of Nursing. So today we will discuss the JIPMER skill test 2023 questions. Okay. So here you can see the mainly we have four stations four station mainly in the skills they are keeping, and each station of the 25 marks they were asking. In first stations mainly two stations they were including of some of the clinical procedure. They may ask like this time they have asked the CPR. Maybe some student have got the CPR of the adult and some student may got the CPR how to perform the CPR on the child. And second questions were there insertion of the Goodell's airway. So how you are inserting, either you know how to which is the appropriate size and color code for the specific according to the age wise of the patient, and how you are inserting, either you know how to hold the Goodell's airway and how to turn during the insertion. So all these things they will assess, and according to the checklist mainly they are assessing the clinical all the procedures. So you have to keep in mind all the checklist before starting the procedure, what all things we have to do, during procedure and after procedure what all things you have to do. Don't forget to do the documentation, because documentation also carry the marks. Okay. And third, and after any procedure how you are discarding, they also must see the hand washing after before, and also see the BMW how you are discarding the waste and all these things. Okay, that also carry the marks. And third procedure we have NG feeding. So they may give, in some station they may keep the NG insertion, how you will insert, how you will do the measurement, and what all articles you have to keep. And second station may they may keep the how you will feed the baby, and may related to this they may ask how you, what all things you will do to check the placement of the NG feeding, NG tube. So all these things you have to keep in mind and you have to prepare according to that. Second stations we have fluid and drug calculation. Like some of the students may got the fluid and drug calculation, drug dose calculation they may ask. So you have to keep learn the formula. So next we have drop factor calculation. So they may ask the drop factor calculation, they may give the 500 ml RL we have to give in 4 hour in micro drip set or micro. So you have to see according to the drip set you have to apply the drop factor. Okay. And sometimes they may ask in fluid calculation, they may ask regarding the burn patient is there and this percentage of burn, and they may also ask you to calculate the percentage of burn, and according to burn patient how we are calculating the fluid calculation. So you must see all this formula before going for the skill test. Next we have surgical instrument and forceps. So in surgical instrument and forceps, basic surgical instrument they are keeping, like you can see the artery forceps, tenaculum, bobcock, mosquito forceps, and other things you can see the towel clip. And some of the HME filter they have keep male cord catheter, Foley's catheter, AFC catheter, and sometimes they may keep the central line catheter, and how you will insert they may ask that also. And obstetrician related forceps they may keep the Sims speculum, vaginal speculum, uterine sound, uterine curettage, retractor. So you must see all this obstetrician, and some of the surgical instrument related to BP handle or blade size they may ask. So all these things you have to keep in mind before going for the skill test. And mainly I want to say today here is any clinical procedure if you are going to perform in the skill test for the JIPMER, so you must keep remember in things how you will do the procedure. So beforehand only, some of the expected procedures in JIPMER is all the common procedure like suctioning, Foley's catheterization, NG feeding, CPR, Goodell's airway algorithm, resuscitation algorithm, and these all are the basic procedure. And IM injection also they may ask. Okay, mainly in case of the newborn how you will perform the IM injections, so they may ask all these things. So according to the checklist you have to prepare yourselves. Okay, so within fixed time, limited time you have to perform the procedure. So you should be skillful and you should be act in that quick time. How you are acting, that depends on you to perform. So skill test is very important for the JIPMER. So it is not important to get the highest mark in just exam. So for JIPMER skill test is more important. So please, all the best, and thank you so much.